Hi, everyone, and thank you so much for joining us today for our Compassion in Action webinar, which is entitled Organizational Strategies to Address Our Nation's Nursing Crisis. We're so grateful that you've taken the time to join us. I'm Stephanie Adler-Yuan. I'm Director of Programs here at the Schwartz Center. And as many of you know, we're a Boston-based nonprofit organization established in 1995 to advance compassion in healthcare. We're very honored to be able to offer this series of free Compassionate in Action webinars, thanks to a generous donation made in memory of Julian and Eunice Cohen. And we are particularly honored to be able to host today's critical conversation. So as you're going to see in a moment, today we're going to hear from some truly leading and wonderful voices in nursing about the most pressing challenges facing the profession today. And we're going to hear too about some promising strategies and solutions for addressing those challenges. We'll jump in just a second. Before we do, I just want to note that today's program is going to be an hour long. And we'll have a moderated panel for the first 40 minutes, and then we will have some time for discussion and questions. So feel free throughout the discussion to put your questions in the chat or in the Q&A pane, and we'll get to those towards the end. So I think that's it for logistics. And with that, I will hand the event over to Dr. Beth Lown, my dear colleague. Dr. Lown is Associate Professor of Medicine at Harvard Medical School and Chief Medical Officer here at the Schwartz Center. And I know she's excited to introduce today's panelists. So over to you.
Thank you. Thank you, Stephanie. Thank you to all of you for joining us today. We are very grateful, and we're also grateful to our expert panel for participating in this webinar. This is such a challenging time for all of us. I was especially taken by recently released results of the American Nurses Foundation Pulse Survey on the workforce and other caregivers, especially about the challenging working environment, staffing issues. And like other caregivers, when asked what an organization could do to increase their work satisfaction, in addition to increasing salary and support, a third of the respondents in this survey said, quote, genuinely listen to my voice and respond to my needs. A call that we have heard throughout and in the aftermath of the pandemic. So we're hoping that today we'll have an opportunity to hear from you as well as our panelists about some of these challenges. Moderating our panel today is Dr. Gaurdia Banister, Executive Director of the Institute for Patient Care and Director of the Yvonne L. Munn Center for Nursing Research at Massachusetts General Hospital. We're joined by Dr. Mary Joy Garcia-Dia, President of the Philippine Nurses Association of America, Allison Nordberg, Program Director at the American Nurses Foundation, Dr. Bernadette Mazurek Melnyk, Vice President for Health Promotion, University Chief Wellness Officer and Dean, College of Nursing at Ohio State University, and Deb Zimmerman, CEO of the Daisy Foundation. So now it is my pleasure just to pass this off to you, Gaurdia, to moderate this incredible conversation, and thank you.
Thank you so much, Beth, and thank you all for joining us. And in addition to these panelists being incredible voices for nurses, for nursing, and really for clinical care, they are incredible leaders in our field. And I believe what they're going to be sharing with us today is going to be incredibly powerful and really food for thought as we think about our nation's nursing workforce. So with that, one of the things we've asked each one of our panelists to do is take about 5 to 7 minutes or so from their vantage point, from their perspective, in terms of their thoughts around some of the issues related to nursing and this crisis that we currently find ourselves in. So with that, I'm going to start with Deb, if you wouldn't mind starting first.
Sure, thank you, Gaurdia. It is an honor to be here. We are at a tipping point. For the last 3 years, nurses have demonstrated incredible grace, grit, intelligence, and ingenuity, and nurses were instrumental in developing community, state, and national responses to the pandemic. There is now greater public awareness of the need for sustainable cultures of health, of the elimination of social disparities, and the creation of robust environments for clinician well-being. Nurses are ready to work with policy experts, business leaders, and insurers on the redesign of healthcare and the creation of robust environments for joy, innovation, and well-being. Nurses are present wherever care is rendered, so nurses know what works and what doesn't. For most nurses, joy occurs at the point of care and with patients. Joy occurs when a nurse or a team can meet both the clinical and the psychosocial needs of their families. I often tell the story of Whitney, a nurse in Virginia who arranged for a dying teen's beloved horse to visit her in the hospital. Whitney's joy as a nurse was in making a last wish come true and helping a family make peace with the unfairness of a terminal illness in one so young. The same was true for Charlie, a cardiac nurse and ECMO specialist in Atlanta, who coordinated a visit in the hospital garden between a young mom on ECMO and her 5-year-old son before she underwent bilateral lung transplant. Mom and son needed to see one another preoperatively despite COVID visitor restrictions. A few weeks after the successful transplant, Mom wrote in a Daisy nomination that Charlie was the wind beneath her wings. There was a partnership between leaders and frontline providers in these two healthcare organizations. By shining a light on the extraordinary work of these nurses and sharing exemplars within the organization and with the public, a culture that applauds acts of kindness and promotes a culture of compassion was created. In 2012, Cindy Lefton found that feedback to clinicians from patients, families, and colleagues cultivated environments where individuals flourish, teams feel nourished, and health cultures take shape. There's a tie to purpose. Subsequent studies have provided further insight into the correlation between meaningful recognition and increases in clinician compassion satisfaction and reductions in compassion fatigue. In other words, a culture that supports the ability to bond with patients and families builds a reserve for a nurse so that they can tap into it on difficult and emotionally draining days. It also helps build the fortitude that we need to participate in the redesign of healthcare. There's been little time in the last 3 years for reflection. It's not surprising that in a study of 5,000 nurses, 4 of the 6 key elements needed for a healthy work environment, including meaningful recognition, were reported as lacking or missing during the pandemic. Numerous longitudinal surveys have identified a significant lack of well-being and emotional health in clinical nurses and leaders, particularly nurse managers. 1 in 3 nurse managers was reported that they were not in an emotional state, and 20% contemplated leaving their position. Virtually every professional healthcare and nursing organization has made nursing and the health of our workforce a top priority. For the first time, organizations are working collaboratively and planning with one another. Much of the work that's underway was needed well before and prior to the pandemic. The pandemic was the tipping point. We have talked for over 20 years about the need to redesign the work for nurse managers. We know the nurse manager provides the foundation for organizational success. Their leadership is reflected in the engagement of their team, the use of the evidence in nursing practice, and in the achievement of patient outcomes. Nurse managers have a powerful influence at the point of care and the well-being of their teams. Why did we need surveys to inform us that these leaders want to be recognized for their contribution, need more flexibility in their work, reductions in their huge spans of control, and support with 24/7 responsibility? The time has come for change. In February, AONL Foundation and the Daisy Foundation launched a call to action entitled Beyond Gratitude, a Tribute for Nurse Managers. AONL is focusing its work on the environment at the point of care and on frontline leaders. As a first step, 7 teams are meeting weekly and building a compendium of best practices on innovations in recruitment, retention, models of care, compensation, academic partnerships, and the creation of a healthy work environment. Daisy is focused on spreading meaningful recognition wherever nurses practice, in replenishing the reserves of nurses, and bringing public attention to the profound impact of nurses on our nation's health. As a CEO of the Daisy Foundation, I hear of the extraordinary work every day of nurses. The public, payers, and legislators, unfortunately, do not. In a study conducted by Gotzi, Houghton, and Hayes in 2020, nurses were perceived as implementers and doers, followers of orders. There's a lack of public understanding of nursing's complexity. That narrative is ours to change, and we must change if we desire to influence healthcare's redesign and have a seat at that table.
Wow, what a powerful start to a wonderful dialogue we're going to have with our exquisite panel. There's so much to unpack here, but I want to make sure that we save enough time for our panelists to certainly share their perspectives and point of views. But there is one comment that you made, several in terms of compassion and culture and our organization and environment of care. But I really like the comment, nurses are ready. We are ready to take a stand. So more to come in regard to that discussion and dialogue. So Bernadette, I'd like to turn it over to you, and welcome.
Thank you. I want to first give a big dose of vitamin G for gratitude to the Schwartz Center, as well as everybody on this webinar today for all your efforts. It has been a character building 2 years during the pandemic. In my role as Chief Wellness Officer, the first in the country at a university, I work firsthand across our university and our academic medical center. I understand the challenges, the character builders that our nurses face. In addition, I've done several national studies studying the health, well-being, and needs of nurses during the past 6 years, including through the pandemic. Bottom line, we have a mental health pandemic in nursing inside of our COVID-19 pandemic. 50 to 70% of our nurses are suffering from burnout, depression. Our suicide rate is higher than the general population. My studies show nurses who perceive they work at a work site that has a culture that supports their well-being have better physical and mental health outcomes. Culture matters. It impacts how people feel and how they behave. My studies have also shown the longer the shift work, the poorer the health of the nurses and the more medical errors that they make. As I've told the C-suite all across the country, we must stop 12-hour shifts. And everybody gasps when I say that, because they say our nurses love 12-hour shifts. But here's the other problem. It takes, on average, 15 years to translate evidence from research into practice, the real world. We can't wait for change. It must happen now. We have been talking about building nurse resiliency for a long time. Our nurses are tired about hearing we need to build their resiliency. We do. We can't ignore that piece. But what we need to do more than anything is fix system issues that we know cause nurse burnout. We know the evidence. We know what works. It's time to not take 15 years to get it into practice.
Again, powerful words with a lot of things we need to unpack and unbundle in terms of the importance that not only have we been through or we're in the midst of a COVID pandemic, we're in the midst of, for nursing, when we think about it, a pandemic as it relates to mental health. And how can we support the mental health of our nurses? The other thing that you said was culture matters. And you're taking a very bold step today when you're talking about 12-hour shifts. And I'm sure that there's some colleagues in the audience are going to ask some additional questions about that. So thank you for these sort of bold approaches in the research that you're doing moving forward. So now let me welcome Allison. Thank you so much, Allison, and really looking forward to your perspective.
Absolutely, and I'm thrilled to be here. So I'm with the American Nurses Foundation, and we're the philanthropic arm of the ANA enterprise. And our enterprise and 3 entities operate under a shared vision of a healthy world through the power of nursing. And this vision of a healthier world, especially now, really begins with the health of all nurses. And my colleagues here on this webinar have been talking a lot about the work that they are all doing. And within the enterprise, we have a number of programs as well. We have Healthy Nurse, Healthy Nation, and there are 6 different health-focused domains to encourage people to get involved. There's the End Nurse Abuse campaign, which focuses on advocacy and support around the topic. There's the most recent Nurse Staffing Task Force, which just released new recommendations. And then within the American Nurses Foundation particularly, we have the Wellbeing Initiative. And we started this in order to offer free, evidence-based, multimodal tools and resources to all nurses throughout the course of the pandemic and now continuing into the future. But we also have the Pulse on the Nation's Nurses survey series, which enables us to hear directly from nurses at different pulse check opportunities and be able to share this information. So far, we've had over 200,000 nurses take one of these surveys to date. And we've been able to share this findings with the media, with government entities, and then of course with the nursing community. And part of why I'm so happy to be here today is that we just released about 2 weeks ago the findings from our most recent survey, and that survey focused on workplace issues specifically. And so there are so many synergies between what we found, what the topics of this webinar are, and then specifically what we can be doing about them. And so I like to look at it from the kind of umbrella perspective. Is that one finding is that only 42% of respondents said that their work or practice environment was healthy. And so when we think about what it means to be in a healthy work environment, it is safe, it is healing, it is humane, and it is respectful. And that's from the patient to the nurse to the larger healthcare workforce. And the survey results point to some places where we are falling short here. Bullying and incivility, for one example, 60% of respondents said that they had experienced some type of bullying or incivility in the last year. And then incredibly concerning, 29% of survey respondents said that they had experienced at least one act of violence in the last year. Now, the overwhelming majority of that does come from patients, and that's unacceptable. And there's still this smaller group, but still, again, unacceptable number coming from fellow staff members. And then we also wanted to take a look at other staffing issues too. And so about a third of nurses said that they always or often had the right ancillary staff available during their workday. But we also wanted to dig into nurse staffing as well, and not just the bodies available, but really focusing in on are the right skills and knowledge available on a day-to-day basis. And what we found is that 50% of respondents said that less than half the time, the right nurse with that right skills or knowledge was actually available. And then we see all of this having impacts on work-life balance. So just 42% of respondents said that they were able to take leave when they were requesting it. And I don't know about you, but I like my vacations. But it also then boils down to almost more on a daily, regular basis, with nearly a quarter of respondents saying that they're asked to cover additional shifts on a daily basis, and a third of nurses are asked to cover additional shifts on a weekly basis. And we see all of this impacting the well-being of the nursing workforce. We asked nurses to use their own definition of burnout. 56% said that they were either beginning to burn out, burnt out now, or really alarmingly, about 7% of nurses said that they were completely burnt out and maybe in need of help. And so I don't want to be entirely doom and gloom with these findings, because I think they do point to a number of opportunities for us. Beth already mentioned one at the beginning of in her welcome comments, but we also found that if nurses are listened to, that does help workplace satisfaction. And then even more at an individual nurse level, just 36% of nurses said that, or agreed or strongly agreed that if they were to go to their supervisor for help related to stress at work, that their supervisor would know what resources to provide. And so knowing about these resources, whether that be from an organizational level, from others that are available through the foundation, the Schwartz Center, and from my colleagues on this webinar, is such an easy thing to do, because these resources exist, and it's about building that awareness. And so I'm really looking forward to the rest of this conversation as an opportunity to build one of these fundamental building blocks.
Allison, thank you so much. You shared some powerful, powerful statistics, and the work that you're doing when you think about over 200,000 nurses have responded to your pulse surveys, giving us specific evidence and information about what those challenges are, but also, most importantly, what some of the solutions are, which is really the basis of why we're coming together today to really talk about, yes, there's compelling evidence, but there's also extraordinary answers. And how do we take some of those answers and put them in place to ensure that we have this healthy work environment? So thank you so much for sharing your insights, and there'll be certainly an opportunity to discuss this in more detail. So now I'm going to turn it over to Mary Jo. Welcome. So nice to have you today.
Thank you so much. And I really appreciate the opportunity to be part of this panel together with our distinguished leaders. When I was thinking about this program, I came across this quote that our cap is the passport to the world, which is truly symbolic representation of the importance of Filipino nurses, as well as other foreign-trained nurses, in having the opportunity through our profession to be an essential partner in the healthcare delivery process. As many of us know, Filipino-American nurses has long been a pillar of the healthcare establishment in the United States. Their dedication to work, their care and compassion for their patients have distinguished them as a valuable part of our medical community. The Philippines has been the highest source of foreign-trained nurses in the United States and other parts of the world in addressing the nursing shortage globally. The dependence on foreign-trained nurses, particularly the Filipino nurses, and the unprecedented COVID-19 pandemic highlight the importance of immigrant healthcare workers in the American labor market. Although there are over 150,000 Filipino nurses that make up 4% of the nursing workforce of 4 million nurses in the United States. One word that comes to everyone's mind to describe a Filipino nurse is care. Our training and education, which is at par with the Western education, plus our work ethic, respect to our elders, and loyalty to service, contributed to our reputation as caring, compassionate, professional nurses. But when the COVID-19 pandemic hit, these same traits made them especially vulnerable to the virus. serving on the front lines, often in the intensive care units, where the sickest patients require high contact, round-the-clock care. Filipino nurses have taken the brunt of the pandemic. By September of 2020, Filipino American nurses constituted over 30% of all deaths of registered nurses in the United States, despite making up 4% of the RNs. And that's according to Kaiser Health News. The PNAA is on the front lines of raising awareness about this concerning issue and was involved in encouraging lawmakers to take action. As the WHO reports, as the World Health Organization reports, there are not enough nurses to take care of the world's population, despite over 20 million nurses globally. So this is where we are right now at the crux of the shortage. And we are concerned with the ethical recruitment of internationally educated nurses. And that has been the work of our organization, being the front lines, advocating for our nurses, making sure that they have fair labor contracts when they are contracted to work here in the United States.
Thank you so much, Mary Jo, for those comments. Very powerful, particularly when I think about the fact that when you were talking about some of the COVID deaths of Philippine nurses, 30%, where you only are representative of 4% of the nursing population in the United States. Again, a tribute to the caring, compassion, dedication of Philippine nurses. And I think another lens that you brought to this conversation certainly is not only what's happening here in the United States, but globally, how nursing impacts and influences the world. So thank you for sharing those insights, your thoughts, and expertise. Now we're going to move into some questions for our panelists to think about as we're, again, the title is really talking about, we've heard compelling data and information about the challenges. The question is, what are some of the opportunities and what are some of the ways that we can provide some interventions? So the first question that I want to pose to our panelists is, we frequently hear that nursing is the most trusted profession. And we hear that year after year after year. And we certainly heard that with COVID when in cities, people were banging pans and writing things in driveways and, really talking about how much people respected and adored nurses in terms of trust. But I've also heard many times that while we're the most trusted profession, we are the least influential profession. And when you think about some of the conversation that's been shared this afternoon, how do we begin to increase nurses' influence on addressing these pressing issues that you all so expertly shared with us this afternoon? Go ahead, Deb.
Yeah, so we have to ask, why does public trust not equate to public interest? One reason may be our whole healthcare system is focused on problem orientation and on cure rather than building a culture of health. And engaging and in persuading organizations like CMS and the accrediting bodies like the Joint Commission are daunting. And nurses may not have the time or feel that they even have the expertise. But is that a good enough excuse? In 2016, the American Nurses Association actually looked at this question and what is limiting nurses' influence? And what they have said, and I really do agree, is that it's partly self-inflicted, and the responsibility to affect that change is really with us. We've not traditionally used our power as the largest of the healthcare professions or our voice to influence national committees or healthcare strategy. The panel suggested that we control our scope of practice, that as advocates, we have the responsibility to influence the care of the environment. We are innovators and we must promote and serve as agents of change. And lastly, we must be collaborators, partners, leaders of healthcare, and actually convene organizations for change. We can't use the barriers as blockades to action. When I think of someone who really is making a difference, I think of Colleen Hole. She's a vice president at Atrium Health. She said to me, I didn't think that I would, and I didn't learn how in school to meet with regulators, but because she has had the courage to go ahead and meet with regulators and with payers, she has been able to secure reimbursement and accreditation for remote monitoring and hospital at home. Because of her work, regulators and CMS has supported emergency and then more permanent approval for innovative models of care. So we have to step up to create that change.
I'd like to add to what Deb just said. Although we're seen as the most trusted, we hardly ever get highlighted in the media as experts on topics. We've got to reach the media more with our outcomes, and we need to measure more so what outcomes that really matter to the healthcare system. For example, when we institute an evidence-based practice change and we save our healthcare systems $6 million to reduce falls, we need to go back to the C-suites and say, look what nursing just did to save this healthcare system this much money, because whether we like it or not, we live in a cost-driven healthcare system. And then we need to come back and say, we want half of those funds we just saved the healthcare system to come back to nursing.
And I would also add the idea of having nurses' voices at more decision-making tables. Many of you on this webinar are probably familiar with the Nurses on Boards Coalition, which its entire mission is around increasing nurses serving on everything from the local community board to their Fortune 500 organization, and how each of those organizations where there's a nurse has an opportunity to touch the social determinants of health. And if we look at even just hospital boards, the last I saw, I think it's about 4 to 6% of hospital board seats are held by nurses. So how can we bring more of those nurses' voices to those decision-making tables, because we know that makes a difference.
And also, I would like to add that each one of us in our community has to take the responsibility and begin by knowing what district we belong and who represents us in Congress. As an immigrant, many of us are not familiar with the legislative branch of the government and how it works. We relegate this responsibility to elected officials while we focus in rebuilding our life here and prioritizing our family and advancing our careers. But it is important to understand the importance of belonging to an organization, just like what Allison said, being part of the board and the impact that we can make in being active. I came to know the importance of this personally when I visited Albany in 2004. I remember taking the Amtrak to go to Albany together with Miss Lolita Compas, who was the first Filipino nurse to be president of the New York State Nurses Association. I was feeling nervous when I was talking to Senator Liz Kruger, but after making my 30-second speech, I relaxed and really focused on explaining the number of nurses who have suffered back injury and the need for ergonomic measures in the workplace to prevent accidents and minimize musculoskeletal injuries. So being part of the board is important, but it's also significant to have a mentor that can be a role model, because we learn along the way in terms of being that influencer.
So thank you all. And it really sounds like some of the, not some, but the ownership of making the kinds of changes in order to be more influential lies on all of us. that we have some accountability and responsibility to be able to move these important agendas forward, whether it's meeting with regulators, and it's wonderful to have role models and mentors to help guide those who are feeling like they need to gain and develop that expertise, the importance of demonstrating outcomes that are important to our healthcare system, and what we as nurses do to impact those outcomes, save our patients, and save, most importantly, dollars in a very expensive healthcare system. And there are a number of initiatives underway, whether it's nurses on boards and other opportunities. We need to get involved. We need to act and move forward. So thank you for that. Great suggestions and recommendations. So Bernadette, you talked about this a little bit, and I'd like to open this up to the whole panel. And you mentioned 15 years in terms of evidence, how long it takes to get into practice. So all of the panelists, how do we accelerate the dissemination of best practices, such as new models of care, leveraging technology, and or promoting innovation as examples to address some of these organizational challenges that we've just discussed? Because certainly, as Bernadette said, we can't wait any longer. It's just not going to be tenable. So thoughts?
Go ahead, Bern.
Sorry, Deb. I have a button that says, because we've always done it that way, with a slash through it. We have got to eliminate that from our vocabulary. I think it's critical we move beyond just dissemination. We disseminate like crazy. We know what best practices are, but it takes years to change those. And change starts with strong leadership. The other thing, I can't believe I've been banging the drum for evidence-based practice since the late 1990s. I really hoped by 2020, I wouldn't have to go all over the world and still teach people the 7 steps of evidence-based practice. But our latest studies still show we have so much opportunity in front of us. Evidence needs to speed up its translation, but it's going to take strong leadership, structures, more evidence-based practice mentors in our healthcare systems. Our latest study that's going to be coming out shows a strong relationship between the number of nurses who are evidence-based practice mentors and complications experienced in healthcare systems. Again, we know what works, but we've got to get it translated quicker.
Thank you.
Thank you, Bern. I want to just add a little bit here that the Academy of Nursing has really been recognizing innovative nurse-led programs that you can go to and check on the website. It's called the Edge Runner. And for over 20 years, these largely small and cost-effective programs have demonstrated sustained reductions in hospital admissions, inpatient complications, mortality rates, healthcare costs. And they're largely directed at disadvantaged and vulnerable populations, such as single first-time parents, adults with chronic illnesses, and seniors. The most renowned and largest is the one that was created by Harriet Kitzman, and I know Bern knows her. It's the Nurse Family Partnership. In this model, Harriet identified the disparities between as a pediatric nurse in socioeconomically disadvantaged moms. And what she found is that if a nurse visited a mom-to-be during their pregnancy and for the next 2 years, and this has been examined for over 40 years, that there is significant improvement in the health and lives of mothers and their children. Nurse visits led to healthier pregnancies, improved health and development of the children, and improved socioeconomic status, not only of that family, but for multiple generations. This is now federally funded and in 41 states and serves over 38,000 patients each year. Now, this is the exception rather than the rule. The beauty, if there is beauty related to the pandemic, is that we know that it was it impacted small, vulnerable, disadvantaged populations. And if we go back to those edge runner, and help implement them and work with our payers, I think we will be able to move us to an organization of success. Now, tomorrow, AONL is also going to be sending out a call for best practices. It's just going to be a simple survey. You can write it up, and what we will do is we will work with you to help raise up that model of care and then help disseminate it and even measure outcomes. And that's one thing that Bern mentioned, and also that Harriet Kitzman did, is really measure those outcomes and work with the payers and bring them to the table sooner rather than later.
So take those innovations, and it's much more than dissemination. It's implementation and measurement and widespread adoption. That's what I'm hearing is where our opportunity lies. So I'm going to digress just a little bit as we're thinking about other questions that may be coming into the chat. Is I have to go back to the 12-hour shifts because, again, I feel like, and I've been a nurse for a very long time, we've been talking about that for a very long time. And most recently, when I hear about the fact that there's a lot of evidence that shows that 12-hour shifts are not ideal for our nurses, there is this pushback that says in the middle of a nursing crisis, when we're seeing the kinds of challenges with nurses and support staff, how in the world can we think about making that kind of seismic shift in our profession right now? So I really would be curious to hear our panelists' thoughts about that.
Once people see the evidence, because it's very strong and it's very compelling, but think about this. Most people don't change practice or behavior unless crisis happens or their emotions are raised sincerely. So I always say evidence plus emotion helps people to make change. Once nurses, because I've shown this data everywhere, once nurses really see the data, understand it, we need to give them credit. They say we'd be willing to go back and try that again. And if 12-hour shifts are too incomprehensible for people right now, let's do 10. All my studies show 10-hour shifts are better than 12. 10-hour shifts can work better. We can figure this out.
I want to add to what Bern just said. The first time I heard Bern say this, and I've been a chief nursing officer for more years than many probably in the audience have been alive. And when she first said this, I almost fainted because virtually everyone in the organization was working 12-hour shifts. But right now, nurses are exhausted. You know, it has been a terrible 2 years. We have to change. And if we keep on doing the same things, we're not going to overcome and be able to have the energy to really innovate and redesign healthcare. Now is the time when everyone is focused on trying new models, because the workforce is the #1 priority for virtually every healthcare and every nursing organization. So sit down at the table, try it, look at the 10-hour shifts and look at other models that might work. and see and measure and see how your teams work. I was skeptical when I first heard Bernadette talk about this, but given these last 2 years, I don't think we really have a choice but to really examine it now.
And this is related to one of the recommendations that came out of the nurse staffing task force recently about investigating these ideas of more flexibility in the work schedule. And so what could we be doing to help more people create float opportunities and really look at these other shift opportunities? I think we found in our survey data, still the largest percentage of nurses do prefer the 12-hour shift, but certainly that 10-hour is actually more popular than I expected it to be, Vern. So there is potential there.
I'll probably, from my personal experience, I love 12-hour shift, and it afforded me the flexibility to go to school, to manage my family. And it's really on our end, from a personal level perspective, to do that self-care, right? And we realized that during the pandemic that we don't really do a lot of self-care. And that's what we've been encouraging our members, our nurses, to take a long, deep look at where you are right now after the pandemic. What are you doing to make your life much better? A lot of people realize that it's not about long hours or working harder, but really coming into terms of how do I take care of myself now? So I hope that in terms of looking at various staffing models, we also look at how do we make our workplace create that work balance and promoting, as what you said, Bernadette, earlier, resiliency.
Mm-hmm. Thank you for that, and great perspectives, and work-life balance, work-life integration. How does that look for every individual nurse? And I like that there are options that, okay, if it's not 12-hour shifts, then maybe it's 10, or maybe it's 8, or maybe it's 6, or maybe it's 4. It's really trying to understand what's going to meet the needs of that nurse, and certainly organizationally in regard to taking care of our patients. So Beth, I wanted to see if there were, I know I can see that the chat is blowing up. Is there a question coming from our audience that we need to pose?
Oh, there are plenty. So there are lots of things. Just sticking with the staffing thing for a second, there are questions about what are the nursing models actually address these staffing shortages. As a corollary, how do you operationalize 10-hour shifts in 24-hour settings? But I think the issue of are there any new models out there that people are actually working with or considering?
I've seen a couple. I referred to Atrium Health, but there are a number that are looking at remote monitoring, where there is the old EICU model, where that is able to, where there's a centralized system of monitoring the patients to help support the nurses on the unit. Yale New Haven has implemented, and they've taken the model that we used during the pandemic to look at how to provide relief where it's needed and emergency care. So Yale New Haven, Atrium Health, and then there are some other models related to bringing LPNs back into the acute care environment. And this time looking at scope of practice, being very focused in how that team works. I've also seen a few other models with new forms of techs, unlicensed assisted personnel really working. So yeah, there are new models that are being out there, and what we're going to do is build a compendium to see what works in one organization or one size facility may not work in another. And we also want to make sure that we're looking at the continuum of care. So we're hoping that we're going to be able to build a compendium of models that are out there, and that should be coming out probably by the end of November.
Deb, I'm sorry, Deb, is this AONL?
AONL is doing that. Yeah, I didn't tell everybody that I'm the president-elect of AONL. So that's why, and I'm helping to lead the workforce task force with Claire Zangerly from Allegheny Health.
Thank you.
Very exciting. Go ahead, Bern.
Nurses are fantastic innovators. We call it workarounds. We figure workarounds for so many things, but they're truly innovations. We have developed at Ohio State a mobile innovation studio that goes across our university and healthcare system, putting teams together that innovate solutions to the issues we are having. I can't tell you how much being able to have voice and innovation inspires our nurses, gives them energy, and decreases their level of burnout. It's not costly, but the outcomes are fabulous.
And I want to add to that is that as we've seen nurses be innovative at Massachusetts General Hospital, when we listen and we are able to execute those innovations and also disseminate and translate them across different units, it also helps with retention because they feel heard, they feel empowered, and they know that their ideas truly make a difference. So we could be here for another, all afternoon, frankly, if not longer, but I want to be respectful of everyone's time. And so one of the things I wanted to do before I turn this back over to Beth and Stephanie is I just wanted to ask all of our panelists if there was one thing that you think would be the most impactful and influential in really addressing our nursing crisis, and perhaps it's already been stated already, what might that one thing be? And then I'll turn it back over to our wonderful hosts from the Schwartz Center. So Allison, I'll start with you.
Sure. So I will always go back to the data, and Beth opened with it as well. It is hearing the voice and listening to the concerns of the nurse and then acting on it. I think that right there will help. Not only do we see it in workplace satisfaction, but in just keeping the nursing workforce healthy and safe.
And Mary Jo.
Yeah, nursing is really a taxing profession. It is physically and mentally draining. I think reconfiguring how we support our nurses in the workplace through new staffing models by leveraging technology to augment and alleviate the physical and mental burden are some of the strategies that our nurse leaders can explore. And of course, promoting a healing environment so we could take advantage of the efficiencies that technology provides are worth exploring as well.
Thank you. Bern.
I would say we've got to prevent more nurses from killing themselves. When we see somebody who's troubled or suffering, I encourage folks, just 4 little words. Are you okay today? And then making sure every nurse knows the new 988 number for Suicide Prevention Center. It is critical, and that we can do today.
Thank you. And Deb.
Well, I had 5, so I'll try to narrow that down. It is our time now. We may not get it again to be influencers. It is time to facilitate discussions with senior leaders on the specifics of the needed changes. Be specific, come together as a group to talk to leaders to initiate that change, because so much of healthcare is really local. What we want to do is raise up the extraordinary work of nurses, bring public attention when you have your DAISY Awards, when you recognize the excellence in your organization, invite the media to to see the significant contributions of nurses and to help change that narrative. What we don't want is the current narrative to cause a further shortage. And we can create a culture of recognition and gratitude that doesn't cost any money. And we can all begin that in our own organizations. It will build reserves for the work that is ahead of us.
Incredible. What a wonderful session. And again, I just want to give my personal thanks to all of you as my colleagues and leaders and faculty today, because you gave some powerful remarks that are really important. And again, the chat is just blowing up with thoughts, suggestions, recommendations, and comments. So thank you all. And I will turn it now back over to Stephanie.
Oh, thank you so much, Gaurdia, for the expert moderation of this expert faculty. What a galvanizing discussion. And I messaged Gaurdia midway saying, I guess we're doing a part 2 because there's so much more to say. I want to acknowledge that there are a lot of great questions and we couldn't get to all of them. And for those of you who raised your hands, I am sorry that the size of this session precluded us being able to unmute anyone, but I hope that everyone felt heard and felt like their interests were represented and their concerns addressed to the extent that we had time for that. Thank you, Carrie. We'll have a part 2, I promise. I want to thank everyone. I know some of you asked about attracting and retaining nurses, and I just want to say that our next Compassion in Action webinar isn't exactly about that, but on September 27th, we have another absolute A-list panel with Drs. Bill McDade, Joan Reed, Teresa Smith, and Deb Troutman from AACN, who will be talking about expanding and diversifying pathways to health professional education. So definitely an aligned and sort of adjacent conversation there. That's on September 27th, so save the date. Registration information will be coming soon. And I also, as always, just want to thank everyone for joining us and ask you, when you see the tiny little survey we'll send you asking for your feedback, to fill it out, because we read every single comment. On that note, I want to thank again Beth and Gaurdia and our wonderful panelists today. Thank you so much for your time and your wisdom. I hope we'll all see you again soon, and take good care, everyone.
Thank you. Thank you so very, very much.